don't know if she talked about all this stuff on Thursday, but this is what helps me keep that wide open. You do not ever want to have this open sitting there waiting, because that's going to stretch this out and you'll have to pay for another one. So I wouldn't use this until the dentist is there. A way for safety for this is to have your floss on your clamp. Purpose for this is what?
So it won't fall in the mouth.
Okay, even though we're using a dental dam, this is still very possible to go down the throat. So this is just me as an Etta. I'm going to be talking to y'all a lot. This is very good for you to just watch your back sitting in this chair. I'm going to have it on the opposite side toward you so you can catch it, not me, because who's the dental assistant? Y'all. These are my jaws. I think you guys lectured on that. This is my bow. The bow is always going to go distal. It's never going to go mesial because this bow is going to get in the way of that high speed or anything else. So again, you want it to be away or distal. You want it how many teeth from the tooth I'm working on? Did you lecture that yet? So you want it 1 or 2 distal. If it's something if it's a class 2, okay? The class 2, that involves mesial and distal. So I cannot have this in my way at all on that tooth, okay? If it's a class 1 on the occlusal, I can put this on that tooth I'm working on because I'm just going in on the top. I'm not reshaping anything on that tooth. I'm going to go all the way back here. Hold that on your boot, please. This man boot. And this can be hard here, putting this dental dam on, depending on patient you're working on. Special needs, you still have to go in there and fix their teeth. A lot of them don't know how to keep it open. They won't keep it open. They'll talk. They want to bite you and not know that they're biting you. I've worked with all kind of pedo. They don't listen at all either. But sometimes my office believed in dental dams because it was us protecting ourselves. So you may have to use this anywhere. A lot of offices still don't believe in dental dams anymore, except for what procedure?
Yeah, root canal.
A root canal. Why?
Because all the debris and stuff.
That's good. I'm looking for something real major
To
that we
isolate
use.
from the other teeth.
No.
So that stuff don't get in the mouth?
What stuff don't get in the mouth?
Oh, the bleach.
The bleach. We use household bleach for that. And this is why it's important we use this, so that way it's not going down the throat. So of course you want to go faster than me. Because ain't nobody got time for you moving slow. Now watch how I put this frame. This is the dental dam frame. This is what holds it apart on the mouth. Again, you have some little notches here. They are sharp and they can stab that patient. These are what keeps that dental dam on the frame. You want to make sure this here is outside the chin and not inside like this. It does not go this way. You see how it's not framing my chin versus this way? Okay? I'm just going to grab these sides of it and I'm going to work on my ends. That's the fastest way for me. Sorry, Mr. Dexter, I got to go in your mouth. What else over here? Can you open another one of those?
And of course, everyone, you wouldn't call it bleach.
No, you wouldn't call that anything. Let's open this one.
Or the patient's going to freak out.
They may smell it, but you don't want to be, they're going to be like, are you using bleach in my mouth? You don't be like, yeah, girl. You don't want to ever say that. Just be like, just using it for something back here. So again, some of these clamps have been stretched because we use them for 4 different classes. So if it's stretched, still just try to use it. Just get the whole concept of it all. Okay. And again, I'm going to put this here in the little hole. Me and Ms. Martinez are dropping things today.
It's in 4 days.
I know. So I'm putting that through the hole. And I want to stretch it out, so I'm going to pull that down. See how it stretched that out? Again, I don't want to just leave that there the whole time because that's just going to keep it stretched out. Again, how many teeth distal do I need to put it on?
One or
to
two?
three.
Oh, two to three.
Well, maybe it's 1 or 2.
So you're working on what number?
I'm on 19 right now, so I'm going to put this
It was
on
already over
tooth
there.
number 17. You may not have a 17 because it's a third. Some people don't have theirs, so I'll put it, of course, on my second. If you want to come and take a picture of this, you can. I'm just going to move my floss out of the way. Because again, you don't want to suction that up. Some of you just might. Should be in the good ones. All right, this one's kind of bent, but you can come and look at it and get an idea of what I'm looking for back there. I have them.
Oh, you have already?
While you guys are taking a picture of that, I don't have you really want to make sure that you are practicing putting on the matrix band on your retainer. This is all the test question here. The outer knob, the inner knob, the notches, all of this. So you want to make sure you know how to put it on. You want to also understand how sharp this matrix can be, because you're going to be putting it on there trying to push it down. Again, don't be too afraid to push it down, but you don't want to push too hard where it kind of cuts you. I've been cut so many times, just like a paper cut. Okay. This also goes. You dispose it where of the matrix. Where do we?
Sharps.
Where do we? In where?
Sharps.
In the sharps container. It's sharp. You also, when you're removing this matrix band, you're
Bless
not
you.
pulling it through
You're welcome.
because it's sharp. I went to school and a young lady went to the dental office and the new Etta, was pulling out her matrix strip and it cut her gingiva.
Oh.
This is a bad rap for us Ettas. You don't want to be that Etta. You don't want to. That's going to get you fired in my office because that's not patient care. That's not customer service, okay? So you want to make sure you're pulling it out. I'm sure she told you that it goes out like that, okay? Because you don't want this notch here to cut the gingiva while it's upside down either. So that's why it's that way. And again, our teeth, they grow out that way. So I'm going to place this here on tooth number 19. I'm going to try to anyway. Did you need me?
I needed to see you're a brand new student.
Oh, okay.
So I needed to welcome her here, but I didn't see her in your lap lighters.
Okay. Okay, thank you, Dr. Warner. It's a pretty big tooth. You also want to know your teeth. Chapter 9 is your friend. Okay, especially for my Eddas. Chapter 9 is your friend. That helps you know the Damon. It helps you know teeth numbers. But it also helps you know which teeth are the biggest. African American males have the largest molars. Okay, so you want to know, okay, so I need a big matrix band for this particular patient because those little ones are not going to work. Okay, this one is actually a big tooth, so I just kind of had to make it a little bit bigger. Okay, so notice I do not have any feet out there.
Is that how you make it bigger or smaller? Okay.
A lot of feet there means that it's smaller. No feet means it's bigger.
Means it's big. Okay, got you.
So I'm just tightening it up. And now I'm going to put my... Some dentists want you to do all this, have all this stuff ready before they come and sit down, and that's okay. Do what they want you to do in that office. Some dentists want to help you. Again, remember your wood, these come in different sizes. Why?
Because
Between the teeth are different sizes.
Contacts are different. A little kid's tooth, I'm going to use the bigger wood chip because it's wider. It holds more space. If they have tight contacts, I'm trying to use the real small wood chips because there's no room to get in there. Again, what's the purpose of the wood chip or the wood wedge?
To move that area away from where you're working. No?
Yes, to fill that area, and then you are pushing that matrix band so it's hugging around this tooth. You do not want any extra space. because that's going to cause extra material, which is causing overhang, which we as editors do not want on our name, because that overhang is what's hanging in between. And then if I've got a floss, what's going to catch? The floss is going to catch. What's going to sneak up underneath that amalgam? Bacteria, debris, micro leakage. And then we have a whole nother problem that we were hired to fix, but we cause even more problems. So we don't want to do that. All right? So you want to make sure they have their PPE on. You have your PPE on. We're working with an amalgam. Now, what you really want to understand, I don't know how far you guys are in the lecture, but if you don't know, mercury is toxic to us. So we want to make sure that we have our PPE on point when we're even practicing or checking off. With me, I'm going to really go in there and I'm going to really prep the tooth for a check off. Okay, so you want to make sure you're really in there. We're doing an amalgam that needs to be replaced. She may do a composite that needs to be replaced. Either way, these teeth have been filled with amalgam and we're really going to take it out. So you want to make sure you're super close with that HVE and you're not spraying air and water. Some of y'all get in there, ooh, spray air, water, I'm the DA. You got to know when and when not to do that. When we're dealing with mercury, you're not going to go in there with air at all because that air is going to, that mercury is going to go in the atmosphere. Y'all don't like wearing your PPE anyway. So what are you doing? You're inhaling the mercury, and that's toxic to your whole body. So this is why we enforce PPE, honey. Wait for the weekend to be cute. Be ugly all the rest of the day, okay? All right, so we're going to start with our basic pass. Like she said, all that's going to be the same. So we'll start with that. I'm not going to have this on at this point right now, but I'm going to keep this on for this demo, okay? As she said, I'm a one-hand transfer, so get with it. I'm picky with my passing. I don't care. I'll try to conform to y'all. I'll try. No, I won't conform to y'all. But I'll try. I'm very picky on how you do hand this to me. I'm going to be very picky and take points off because this is a whole new world. You have two sides on a lot of all of these instruments. You have a small end and you have a large end. I'm looking for you to pass me the small end first because we're going into a small area first. So I want to make sure that I get in there and push all of that amalgam underneath those little areas first, okay, before I use the bigger end. So I'm looking for you to pass it this way, okay? So we're going to do a posterior too, so make sure you have the longer needles, okay? But I can talk to you. I'm also going to be grading on that a lot more, your interaction with the patient. And I know it's Dexter, but I really want you to make believe in these two mods because you're going to be doing these procedures the most. If you're not corona polishing, if you're not taking x-rays, and if you're not doing study models. As far as procedures go, these are every day, all day, what you're going to do. So I do want you to try to perfect this here. Okay, let's go. So again, there's already an amalgam in there that I'm replacing. So I wouldn't want you to go in there with bursts of air at all. Maybe go in there with a little only water, okay? Okay. What you also want to do, and I'll talk about that a little later. Okay. Put that thing, girl. Put it, and then just put that water right in there. Yep, you can blast it with air and water if you want, as long as you're putting it like that. Okay. If you're just going to put it on the side, then just water. Okay. Now I'm going to go in with my slow speed. Again, when I pull out, you go in immediately and clean that area. It's only going to take me a second to grab my slow speed. Okay, go back in place. Stay out of my way.
You guys see behind me?
Way.
Can you see Taylor? Okay.
So with the slow speed, I know with some of you guys help and you do bursts of air with the slow speed. Again, if it's an amalgam that needs to be replaced, then don't. If it's just a tooth that has a cavity, go for it. Okay.
So basically, it's all in the absence of mercury, basically. Okay.
Yeah. Okay. Okay, she's handing me the spoon excavator next. She's handing me that because there's still a little bit of decay in there that my round burr couldn't get out. So I'm just going to go grab that. You can get that gingival margin trimmer out. It's right, isn't it? Yep. And what you'll find with these, I need you to put every instrument back where you got it from. Because some of these instruments you're going to use more than once, like my ball burnisher, like my mirror or my explorer. You'll need to put them back because otherwise it's going to take too long for you to find them. Okay. Give them a good rinse there. So again, make sure that your matrix is loaded on your retainer before we sit down, so that way. But I would like each of you to do your own though, okay? So that way you know how to do it in case your office does it. The liner and base is here. So again, I'm pretending like this is an MOD amalgam. It's a pretty big one. So I see some pink. So the pink is the what? Pink is the pulp. Okay, so because I see some of this pink, I haven't gone into the pulp, but I do want to protect it. It was a really big cavity. So that no micro leakage gets to that pulp, we're going to cover it with this liner and base. So you'll just pretend, put one dot there, one dot there. You're not going to use a big mixing pad. That's what these small ones are for. Okay, and like she said before, this is my die-cal instrument or my applicator instrument. This is what you're going to do with that. That's how you're going to mix it. Again, we're not spatulating with these two dots. There's no room to spatulate.
Is that called the liner application?
Liner and base. Mm-hmm.
Okay.
Mm-hmm. So if you'll hand me that. Mm-hmm. Keep that close to me. And all I'm doing is putting it on the floor and on the walls because I want it to harden up and create that barrier. Okay. Again, this is something, some dentists do this anyway, whether they see pulp or not. It's just to watch their back. And that's okay.
I'd be doing it too.
Heck yeah. You at us, I would do it just because. I don't want my name out there on the streets no. Because you know these streets be talking, y'all.
They do.
And then it says this is the cotton part.
So what you're going to do with this, what is it, a cotton roll? I'm going to create my own cotton pellet. We don't have it. Your office may have it. Mine did have them in different sizes. I'm just going to make my own ghetto fabulous cotton pellet. Boom. And it's made. So what you're not going to do, though, is dip it in there. Just get your forceps and tap the top as if you did. Put it in there, okay? So this is the actual liner, the varnish. So this here is also when you see pink there at the pulp area.
You put it in the hole?
Mm-hmm. It's all going in the hole, all of it. Okay. Some offices use one, some use both. It's just easy to use both. It's just all protecting it. You did that one already. You just need to mix amalgam. So you want your amalgam to be already in the amalgamator, ready and prepared. Okay. You want it on the. How many seconds did she say she wants you all to have this on?
20 to 30 seconds.
Mm-hmm. So it's already should be on the. What is that?
10.
You want it on 20. You're gonna push this little button there, and you'll hear it turn. It's not plugged in, but it makes. I think she did it for you guys. Did she show you how to do it? Did she show you what the amalgam looks like?
Yeah.
Okay. So after you pull that out of there, you may want to, just so that way it's broken through, once you pull it out of the amalgamator, just kind of hit it on both sides on the countertop, just to make sure that it's broken through that. Open it up, you're just going to twist it and pop it out. You can either put it in the amalgam well, or...
Are we really doing this when we check
Yeah,
off?
when we check
Okay.
off for sure. I am anyway.
Okay.
Or you can also put it here on this little this cloth, okay? If you're putting it in the well or the cloth, if I put it in the cloth, I'm just going to kind of roll it up just so it can kind of be like a hot dog. If it goes in there, it's just fine. Again, this has a small end and it has a large end. Which end do I want? I want the small end first. Again, you're going to put your finger on there, not there. That's pushing it out. That's taking, you're just pushing it out. Okay, so put your finger under there. I like to use the side to help condense it in there. Okay, I'm also going to do this side too. You're not going to pass it this way or that way. Because if I pass it this way, that's going to come out. Same thing. This mercury, I don't want anything to fall anywhere. If it does, again, just suction it up. But I'm going to pass it sideways. Okay, small end first, so pass that to me. What's wrong with me today? Okay,
I thought I did something.
so I'm going to put that in there. I may use both sides. I'm going to use the small end first mostly. I'm going to give you back that large end. You're going to hold that for me. Notice she's giving me my condenser. Small end first, okay? And I'm going to go in there and condense. I'm just pushing. I want you to hear you editors, you want to hear that noise because that means it's pushing in every corner that dentist made in that prep, okay? Arm may get tired too. That's why a lot of editors get carpal tunnel because we be busy, y'all. I'm going to have her give me that. I'm going to take my large end now and I'm going to put that in there. We're just going to go back and forth. She's going to put some more of that amalgam in there. And it's got to be a fast process. I don't got time for you. Come on now. And we're just going back and forth. More, please. If there's no more in the well, this is where you have extra there. You want about 3 or 4 carpioles right there. If you already are looking at this patient's chart, so you already know how small or big. How do we know how small or big? What are we looking at that tells us what size this is? Classes, and MOD is huge. So I know I'm going to need more. If it's a lingual pit, it's something small. So I may just need 1, okay? So I'm going back and forth. I'm done now. Keep that in your hand because I'm done. I don't need any more of this, but I still have to condense. And as it gets higher and higher, I'm going to go to my larger end because there's no little places I've got to get to now. I'm pushing it toward that matrix band. I want it to push toward that area because that's my wall. That's what I'm trying to recreate is that area that decay chewed off or ate away. So I'm not just pushing down, I'm pushing sideways as well, those who are editors. She's giving me the ball burnisher next. Why?
To smooth it?
To smooth it. Burnish it smooth because it's just packed in there. So now I want it to have a smooth look. So I'm just going to go over the top and it's going to make it nice and shiny when I do that. Just over the top. I'm going through every pit, every
Just
over
like
everything.
with the brush,
Yep.
with the composite.
She's handing me my Explorer now. I still have my matrix band on. She's handing me this Explorer so I can get excess material from around tooth and matrix. So there is no overhang. So anytime y'all want to come up in my bubble, y'all don't have to be so. I like people in my bubble. I'm just going to clean around tooth and matrix in between there. While I'm doing that, you need HVE. Now, what I was going to say earlier, those of y'all who are so proud to get that certificate and you're an ETA now or you're a dental assistant, don't get too proud and go over that prep, all of that amalgam I just placed with my HVE.
I agree.
A lot of people get excited going in there and just start, ooh, let's go right over that. It's going to suck all of that amalgam out that I just put in because it's not dry yet. Amalgam takes 24 hours to completely hardened. You need to know that for your post-op. Okay?
So how do we put it into suction?
So, yeah, just right on the side. All you're doing in here is getting the amalgam out.
just the rest. Okay.
You're getting the bulks of the amalgam out. Again, you're not using air. Because what are you going to do when you go in there with that air and water? Amalgam's going to go all over the place. What's wrong with amalgam?
It's got mercury in it.
It's toxic. So we don't want that in the air. Again and again, don't go over it. Because if you do, I'm firing you. Straight up. Okay? So I'm getting that out. Now I'm going to go ahead and take off my matrix band. I'm going to start with my little wedge. Some teeth you can just pull all of it out together, depending on how tight their contacts are. But again, I told you this is so sharp, so you don't want to even wiggle it out. Because what am I doing on the buccal side when I'm doing it that way? I'm cutting it. If I do it this way, what's on this side?
Lingual.
Then what's in between? Distal and medial, so everything is jacked up. Whose fault is that? Who lost a job today?
You.
Who's on unemployment? You. Oh, we don't need those problems. So, how you want to also take it out is if you take off my Toffelmeyer retainer. Doesn't want to do it. You can just hand me the forceps, the cotton forceps, cotton. And I'm going to pull it up toward the occlusion. Again, I'm not going to pull it through mesial or distally. Oh, no. Okay? I'm just going to pull it right on up. Very gently. Okay? That goes where? Do we use that on Miss Jones who's coming in next?
No.
Absolutely not. So what she probably does want to do at this point is give them a good rinse. Or a suction at least. If that matrix band so happened to irritate the gingiva, sure, give them a little rinse in there. Make sure you're paying attention to underneath the dental dam. Because guess what may be going underneath the dental dam? Water. Guess what else can get in between there? Amalgam. So you want to every now and then peek under there, whether you're ETA or just a dental assistant. Use this little thing, go right underneath there. Or you can have me do it on this side if you're at and suction real good, okay? Some of them will be like, but to me, I'm drowning, okay? So let's just make sure you pay attention to that. Some may just want a courtesy rinse because they're mouth breathers and they just are parched under there. This is good customer care. Just for this stupid thing here, I hate it. I really do, but it's going to be your friend. So this is my Hollenbeck. Hollenback. Either way, it's a Hollenbeck. Okay, this is used for my flat surfaces, which is mesial or buccal and lingual, also facial. This is for my mesial distal, okay? So all I'm going to do is take this part from mesial and distal and go and carve. It's a carver, one of them. So I'm just carving. Whatever areas are high with amalgam, because I'm going to put more amalgam in there than less. So I do want to carve. So I'm just going in there, I'm carving, making it flatter. You want to make sure you have my assistant is kind of, she's socializing right now.
I'm sorry.
She got to be fired.
I'm sorry.
So I'm just bringing it down, and you're just picking up, pretending like a little amalgam there.
Oh.
Now, if I have to do a little buccal pit on the side there, then I'm going to use my flat end. And all I'm going to do is just start flattening that buccal or lingual. Okay? You're going to hand me my cleoid discoid now. This is also a carver. Okay? And with this, I'm going to go in and try to recreate the anatomy, that occlusal, those pits also in there. Now, remember, we're not God. Okay? Remember that. So if you're not on that level yet to where you've learned how to recreate the anatomy, at least get enough amalgam in there to where you cover that hole, okay? So I'm just going to go in there and start recreating it. I'm just carving. You want to make sure you have that, yeah. So this is why I'm a one-hand dentist. Because when we're dealing with amalgam, you've got to make sure you keep this in your hand. because I'm carving and I don't want any to get in my
his
patient's
mouth,
mouth.
yeah.
Me as an ETA, me as a DA.
Right.
My dentist should not be worried about that. That's not what his job is. Your job is to go under there, ask, do you need suction? A lot of them, their tongue is under there. They can feel that amalgam. When you see that tongue moving around, which you'll see on here, that's telling me there's something in there I need to get. Okay?
Yeah.
So I'm carving. I've carved it. It looks ugly. So now I want to make it nice and smooth again. What do I need back? Give me it back. Oh, I'm going to use the larger one this time since I'm all the way at the top. I'm smoothing it, making it look nice and fancy. Because I'm a really good ETA. But you all, please, don't be cocky about it, but be confident. Those of you who are trying to be ETA and want to be ETA, get in, whomever is the ETA, get in their bubble. Glean from them. Ask questions. Don't be annoying, though. But ask questions. Make sure you say, can I see that? How did you do that? Okay? If that's where you're trying to get to. So, we've cleaned it. She's going to give him a good rinse now. Again, she's not going over that amalgam because it's not what now? It's not hardened. Do we know how long it takes?
24 hours.
That's part of your post-ops. So you want to make sure you're remembering that while you're chairside or ETA. This time I'm done filling the tooth, but there's still extra amalgam in there. So you want to make sure you're going in there with that HV. That's what it's for. High volume evacuator. It's to get those big amalgam pieces up. So you want to make sure you're suctioning first. Then you can go in there when you see no more amalgam and give them a good rinse. Now we'll remove. It's up to your dentist. My dentist will allow us to put it on and take it off. So this is why you want to make sure you're practicing it all. I'm going to take it off. Again, you're not rubbing. You see these jaws here? They're intense, aren't they? You're not rubbing on enamel with this. You want to make sure you're opening that and spreading those jaws out, especially you ETAs or you DAs who are allowed to take this off. We don't want to just fix one problem and create another problem because you're being careless with removing that clamp. The dental dam frame, again, just take it off. Some people's mouths will allow for you to remove all of this at once, and that's not wrong. Okay, but some will not because of those tight I'm handing that to you. Some of the do you have scissors in your Again, I don't want to go in there and pull this dental dam off because what's not dry yet?
The amalgam.
How long does it take?
24 hours.
Okay, so you're keeping that in your mind. So if I pull this off
It's
and
gonna
there's
pull the
some
amalgam.
what's going to come out?
All the amalgam.
Why?
Because it hasn't
How long does
hardened.
it take?
It takes 24
So
hours.
I'm going to go here buccally. I'm going to come over here because the tongue is lingually. This is a little Timmy. He like,
My boy, young Tim.
I don't want him to get cut with this. So I'm going to pull this to the side and I'm going to cut those off and it'll come right out. I'm still being careful of that amalgam because what?
It's gonna take 24 hours to dry.
Okay, you guys are listening.
Now, is that the suture scissors or the?
It's Crown
Crown Bridge.
Just Crown and Bridge. Yeah. If there's a little of that material left interproximally, what am I going to do?
Take it out.
What am I going to do? I'm going to floss it out. How do we get interproximally? Flossing. Got to pull that little green sucker right out of there. Okay, it's not dry yet, but I still want to go in and check the contacts and bites.
Are we using a knot to?
No, you don't need a knot.
Okay.
There's no
Yeah,
cement in there, okay? So I'm just going to go in there more than once. I'm just going in there to make sure none of this floss gets caught. I'm even moving it down, a whole new piece of floss, just so I can go and make sure none of it's getting caught. If it's caught, what is it?
No.
What is it
Overhang.
again?
Overhang.
What can overhang cause?
Oh,
Micro
leakage.
leakage.
What else will it not allow me to do? What gets in there? Debris, all of that stuff. You're the ETA. Your name's on there, so we want to make sure you're good ETA. Now we're going to check the bite. Bite down. And again, what did Miss Martinez says? How do you check a good bite? What should be blue?
The teeth.
Not what?
Not the
amalgam.
not the amalgam,
Okay?
yeah.
So I'm gonna bite down. Do we lower the amalgam as Edda's if it's too high, or the composite?
Yes.
Do we go in there with this?
Yes.
No, we don't.
No.
We don't get to touch this at all.
Oh.
We don't get to touch this as Edda's or dental assistants. We live in Colorado though, and I've had a lot of students that come and said, "My dentist lets me. My dentist lets me." For me.
I don't know what you're talking about.
Ain't none of my business.
I
Okay?
thought Eddas were allowed to use the high speed.
Are they? Not here. Were you allowed to use the high speed, Miss
As
Martinez?
long as it's only a finishing burn.
Yeah, that's it, but not for anything else. No way.
If it has to be a flame or a bulb, but finishing style, or
Yeah.
the only time I can use a diamond on a high speed is adjusting. Right.
Yeah, I wouldn't
And then you have
allow
to
that.
do then you have to do rubber.
My dentist was like,
I'd be like, you
you're not gonna do it. So to each his own. Neither one is wrong. But if you want to learn this stuff again, sit up under your Etta, glean from them. Glean from them. Don't make them feel like you're coming for their job, because some of them will withhold information from you. Just be like, I'm new. I'm just trying to see what you're doing. You don't have to tell them I'm coming for you, even though you are. Okay. So after that, she's going to give him a good rinse and then give him his post-operative instructions. Again, which is how long?
24 hours.
That's major. That's major because you don't want them to go home. Let me tell you what I did. When I got my thirds taken out, I went home and I ate right away because they told me not to eat before. So I was way hungry when I left. I'm hard-headed, still a dental assistant, but I ate.
I'm hungry.
Okay? What's sticky? What can pull this amalgam out?
A lot of stuff. Yeah.
Which is what? It's pre-ops.
Caramel, sticky foods, yeah.
What else? Breads?
Breads,
I'm
yeah.
gonna go get a burger, but that bread is really sticky.
Yeah.
We don't think about that kind of stuff even for an amalgam.
Dang.
So these are good post-operatives as Eddas or DAs. You're left with with them. The dentist is next door down the hall.
Right.
You are supposed to let them know. So if they come back, who is it looking bad on?
You.
You, because they're gonna say, "No one told me that." Anyone ever went to the dental office and things that we teaching you to tell y'all they haven't told you?
Yeah, yeah.
That looks bad on them. You don't want us to talk about y'all.
No.
I went for my white tray, my bleach tray, and
Yeah.
my assistant didn't tell me like how to use it or nothing. So like the front office lady was like, "Oh, here, since she didn't tell you this, you have to do this."
And what that does is set you apart from everybody else because when in Rome, you'll hear me and Miss Martinez tell you guys to do post-ops verbally. A lot of them don't. They give you the paper and send you home with it. But like I always say, I throw that in the back seat.
Yeah, I'll look at it, yeah.
I don't really read that. It sets you apart when you can verbally tell them. Now they can't say they didn't know. And then you're also doing what? Patient progress
Patient
notes
progress
are
notes.
so important.
Notate everything, yeah.
That's it, guys.